The impact of social determinants on diabetes. Diabetes is a chronic disease that affects over 29 million Americans. While it can be managed, the risk of developing diabetes can also be prevented through determinants such as diet, exercise, and community engagement. This video will explore why social determinants are important to public health and how they impact diabetes rates in America. The determinants of health, also known as the social determinants of health, are factors in our environment that affect our health status. These determinants include educational attainment and employment opportunities for adults, access to healthy food, safe neighborhoods with low levels of violence and exposure to toxins like lead or air pollution, living wages so people can afford housing near good schools and transportation options to get there. All these things can have a significant impact on your well-being. Determinants such as education level, which is closely related to class identity, have been found out to be correlated with diabetes rates across different countries around the world. The prevalence of obesity among children has increased significantly over the past few decades, but what's interesting is how it's been steadily decreasing in children from poor families. Poverty may be related to diabetes rates among different populations, as people living in poverty tend to have limited access to healthy foods such as fruits and vegetables because these are more expensive than less nutritious options like sugary drinks, which lead some individuals down a path of unhealthy eating habits that eventually puts their body at risk for diabetes. There are also determinants related to the social and economic conditions of communities that can impact diabetes rates, such as lack of access to healthy food or opportunities for physical activity. Numerous studies have found links between these determinants and increased risk for type 2 diabetes mellitus, which is often linked with diet-related health issues like obesity and sedentary lifestyles. Social determinants including poverty, limited educational attainment, neighborhood violence exposure, housing quality, transportation availability/accessibility all provide a foundation on which Americans live their lives, and this impacts public health outcomes such as diabetes rates across different populations. Social determinants play an important role in how we feel about our health status, so it's important to think about them and how they can help improve our health or make it worse. In this video, we explored determinants of health and how they can impact diabetes rates in America. These determinants play a significant role in how we feel about ourselves, which is why it's important not only do things like educate yourself but also be open-minded by trying new experiences with friends or people from another culture you may not otherwise interact with if you don't make a conscious effort to do so.